You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures, according to my first guest. He says you can get a fixed set of teeth, a permanent set of teeth, in just a few appointments. With us, we have an expert on the topic, Dr. Haghighat. Dr. Haghighat, welcome to the program.
Thank you, Randy. Pleasure to be here.
Before we get into today's topic, for people that don't know you,
Yes.
Who's your typical patient? I understand you're a board-certified periodontist. So what are the different procedures you do?
We treat patients with gum disease. We
Okay.
treat patients with a host of aesthetic issues,
Like what?
smile issues, recession, people that are long in the tooth, for example, they need grafting done to correct their smiles, get a more aesthetic smile. We deal with people with missing teeth, and at the end of the spectrum, really, which we're focusing on more and more, is patients with missing teeth, denture wearers.
People don't like going to the dentist, right?
They don't.
And they especially hate going to the periodontist, I bet, right? They're in trouble by the time they get to you.
For the most part, yes.
Do they say it to you?
Unfortunately, we hear that.
What do they say?
But after the experience, I think things change. So we try to put a spin on it to make the visit more friendly, more comfortable for them.
So moving on to specifically dental implants.
Yes.
So what are the different categories of dental implant patients that you see? Because we're talking a lot about no more dentures, by the way.
Yes.
And do you believe that? That's the future of dentistry?
Absolutely.
No
I
more
think
dentures?
That's where we're heading. So yes, we're dealing with patients with dentures. They've been either edentulous or without teeth for a short period of time, something new to them, or patients that have lost their teeth for over 30, 40 years.
So after 30 years in dentures, is it too late at that point?
It isn't. The option still exists, especially with the new technology that is out, and we'll discuss that in a few minutes. Yes, the option is there for them to have a new set of teeth, fixed, permanent, so they can get their smile back and confidence back again and enjoy life as they used to, which they've forgotten.
So when we hear things like teeth in a day with dental implants, I mean, going in with no teeth, walking out with teeth, it's true?
Yes, it is. It's
Okay.
all feasible today. Things have changed since a decade, 2 decades ago, when we first started getting into the implant arena here in the US, which was fairly new in the 1990s. There's a huge paradigm shift that we're now offering patients teeth in a day, something that used to take a long time to accomplish.
Sounds painful, though.
It isn't.
Really?
No, it isn't. Again, that's a myth. So previously, implant surgery was more difficult. And it involved a lot of grafting, a lot of incisions, reflection of gum. But we have the technology right now to do things painlessly, quickly, and that saves a lot of hassle for the patient.
Are there some patients, like let's say a denture wearer,
Yes.
goes in a perfect world? I mean, have you had a patient that the next day they go, that was easy?
Absolutely, nearly all of them.
Really?
There is always the case
Yeah.
that
Obviously.
occasionally, yeah.
Okay.
But for the most part, they always say that I wish I had done it years ago. Why did I wait?
How soon could they go back to work?
Almost immediately. So maybe the next day at the latest. So most of our patients return to normal function within a day.
Hey, now, denture wearers.
Yes.
You know, I did some Googling knowing you were going to come here. And I
Yes.
guess there's like 50 or 60 million people with dentures,
Yeah.
which I didn't realize it was that big of a problem.
It's a
So
huge problem.
would you say in Oregon, what? How many denture wearers?
if-
Upper or lower?
You're looking at probably about just under 1 million
Is that
people.
right?
If you're looking at the population at large, in the US, you're looking at probably 37, 40 million people that are edentulous or have no teeth. In Oregon, you're looking at probably about 15% of the population.
So almost
Roughly,
a million people
yes.
have enough. Now, if it's so good, because you're saying with 2 implants, they could get something, a full arch of teeth that snap in,
Yes.
snap out, or 4 to get a full arch, a fixed set of teeth. Why aren't they all doing it? I mean, help me understand that.
So for the most part, denture wearers don't go to the dentist. When you look at studies,
Good point. Okay.
denture wearers go to the dentist probably once in 12 years.
So nobody's telling them to do it.
So they're not really there. They
Good
think
point.
it's over. You know, the denture is the only option they have. And because of that, they don't seek alternative treatments. And they've been told, this is it. You have to put up with it and cope with it.
Now, couldn't the dentist argue, though? Because you tell me on the phone, and I was talking to a dental buddy, general dentist, says, you know, Randy, that immediate or that same day.
Yes.
He was even skeptical about this. I mean, you could do it.
You can do it. There's plenty of research now.
Okay.
It's nothing new really to the implant industry. It's been over a decade, maybe longer, that we've been doing immediate
But
placement
what if you
of
don't have enough bone? Like
Well-
you said, somebody's in denture wear. My mother, in dentures, she's 78. She's been in dentures since she was about 32 years old.
Yes. So
If she's somewhat healthy, I mean, is she a candidate or is that too old?
I don't think anybody really. I think everybody is a candidate.
Okay.
Almost. There's very few people that really are not suitable to get dental implants, but for the most part, most people are candidates. And
But
as
at
far
that
as
age,
bone
it seems like
grafting,
they would fall out.
the denture will fall out.
Yeah, I mean, yeah,
Oh,
it
the
seems like
implants
the
will
dental
fall out.
implants would fall out. I mean, at 78 or 85, even though it's young today.
Not really. I mean, integration of implants happen at any age, unless you're really.
Integration meaning what?
It means that when you put an implant in, it fuses with you, becomes part of you.
So the bone, your own bone
grows
grabs
into
onto
your
it.
implant, so it becomes part of you. You can't really take it out anymore. So it's part of you, and that's why it's the closest thing we have to natural teeth. But age really isn't a factor. Everybody heals, and dental implants are suitable at any age.
So on your take in Oregon, of the just about 1 million people that have a denture, do you think a lot of them self-diagnose and they say, I'm too old?
I'm too old, and they've been told that really is not an option. And
By
it's
another
expensive
dentist?
by
By
another dentist and by
Does that
friends.
ever happen
And
to
they
you?
accept it. We adapt to whatever situation we're put into.
But does that happen where you get a patient and they say, doctor, I was told I can't get dental implants?
Every week. So we get patients
Really?
that come in
Okay.
through referrals, through word of mouth, just to explore the options. And when we tell them that it's an implant, this full mouth situation, or even a single, an overdenture case, which you snap in, snap out a denture that they already have. When we tell them that yes, it's an option, they're at first it's almost they're skeptical.
Like they don't
about what we're
believe it.
saying. They don't believe it. No, but over time they accept it, and we take them through treatment, and we get patients referred through word of mouth that way.
What does it sound like? Okay, so a denture wearer is referred by somebody to you,
Yes.
or they hear about you, they Google you or whatever. What do they ask every time? Like, what is that consult? Like, what do they ask? Just like what we've talked about?
Yes, exactly. They say that they've been long-term denture wearer. They're
Right.
uncomfortable, they're unhappy, and they're exploring different options. And is this something that we can help with? So almost immediately our response is yes, we can. So if you've been told that dentures are the only way and implants are not an option for you, then we need to talk.
Okay. Do you ever have medical doctors tell their patients?
A
Not
lot of
good idea?
medical, yes. We've had referrals from medical professionals.
Okay.
And for that is because denture wearers have issues with eating. It creates digestive problems, for example.
Okay.
So when we're looking at scenarios like that, how can we help? Well, the way we can help, the way we can change their lifestyle, is to give them something more permanent, like they used to, which they've forgotten by now. And we're giving them a fixed set of teeth so they can now enjoy food, eat the right type of food.
Are denture wearers, I mean, obviously a denture wearer, and I
Yes.
know a few, they're not going to tell me their problems, they're going to tell you. But are they, for the most part, somewhat miserable?
They're miserable, yes. I mean, their self-confidence is down because they don't like to smile much, they don't like to socialize much. Their eating habits are off. You don't really want to eat in public, for example.
Do they tell you this?
They tell us, absolutely, yes. And it's not fun. They've sort of adapted to that situation. And now here's an option for them to change that completely, and in a matter of hours. So they're in our office in the morning. By lunchtime, they're suddenly a whole new person.
Is that right?
Yeah.
It sounds like an exaggeration, but I guess, I take for granted because I have teeth.
Yes.
But you say they're a whole new person. Like what? Like what have you heard that
They're
even surprises
happier.
you?
Yes, they're happier. They are, again, the confidence boost.
You see it?
High.
You
You
see
see
the-
it
the changes?
because they're more confident in their smile. And smile is an important factor socially. I mean, when you look at somebody, you're looking at initially their eyes, how
Okay.
they look back at you. And
Yeah,
then the
yeah.
second thing is really the teeth. And that's where you focus on for the longest time. And that's when you start the conversation, you're looking at the mouth and the teeth. So if that's missing, you know, there's an issue. You do less of it. You do less smiling, for example.
Yeah. Well, there's no doubt about it. I mean, if a smiley person is more approachable.
Yes,
you know, we talked in my green room a little bit about it. And so with you, of all the areas of dentistry,
yes,
would you say that when you take a denture wearer, give them a fixed set of teeth, this is the happiest group of...
This is really, for our practice, this is the most rewarding part of our specialty, because you see the change immediately. The change is huge from what they're presented with and what they end up with, all in a matter of hours. You don't have to wait the 8-9 months or so before you see that change.
I told you, I had a doctor, an oncologist that I interviewed here on this set. Young guy, 50 years old, and he goes, told me about his dental implants, been sitting in there for 6 months or so. Would you say, and I didn't say anything to him, because I'm hearing you guys say that you could, you know, but a healthy person like that should be able to go, if they go to the right doctor,
absolutely,
same day, get an implant and get a crown, a tooth on top.
Yes, for the most part. I mean,
so that's like old school with this guy?
That's old traditional way. I'll
send him this tape.
Yes, that is. So, I mean, in our practice, what we do, 9 out of 10, and it's not really, it doesn't happen in every single, let's be realistic, it doesn't happen in every single patient.
Yeah.
But for the most part, 9 out of 10 patients get that immediate implant. So whether the tooth is coming out that day, whether they've been missing a tooth, the implant goes in immediatally that day. So you don't really have to wait.
And pain is not something they're really making a big deal out of.
No, pain is virtually, I mean, I'm not saying it doesn't exist. Yes, an Advil will take care of it. Most patients go away with, 24 hours. They call us and say, I'm comfortable. So it's not as it used to be before. So before, we used to do a lot of more invasive procedures in order to do that.
Now, you have a CT scan right there.
Absolutely, yes.
How does that help you?
So,
because you said it makes it where it's lower or less downtime.
Yes.
I don't understand that.
The technology has helped with this whole paradigm shift that we're noticing in implant dentistry. So one of the technologies available to every office is a CT scan. A CT scan really looks at a patient, or helps us look at a patient in 3 dimensions. And we can get rid of all the unknowns, so we can treat a patient knowing exactly what to expect. And for the most cases...
Like exactly where to put the implant.
Exactly where to put the implant in. And for the most part, we can do this without raising the gums back. So it's...
So in the old days, when you were doing this 15 years ago, you're saying they had to cut apart the gums more? So
peel everything back.
Oh, really?
And that creates pain. The actual implant doesn't really create pain.
The bone.
But the bone itself. There are no nerve endings in there really to create pain. But when you're reflecting the gum back, that's where the pain comes in.
Interesting.
Yeah. And because we don't have to do that as much these days, given the technology that we have in office, patients are much more comfortable. And they go in, take an Advil, and we're done.
So if a denture wearer is watching this, okay, and you're a periodontist, you're a specialist, does it cost more to go?
No, it doesn't.
Is that a fair question? I mean, does it cost more to go to
No, it doesn't. No, it's, again...
Do you need a referral to go to you?
They don't need a referral. If they know us, they can find us on the web. They can come to us directly. So it doesn't cost more. And in fact, a lot of patients comment that we're not as expensive as the treatment they're getting.
You said you're like one of the least expensive guys.
I don't want to say that.
You did tell me that, though.
I know.
You did say that.
But I don't want to say that. But we try to be competitive, yes.
Okay. So, and you're going to work with another general dentist anyway,
absolutely.
Right?
We have a host of very skilled general dentists, restorative dentists, that really take the work that we do, the foundation that we create for the patients, which is the surgical portion, to a beautiful finish.
So let's move into denture wearers specifically, their options as far as what's available to them.
So a denture wearer, the simplest form to give them something more permanent, more secure, is 2 implants. So 2 implants in the lower.
Like on the lower right here.
Absolutely. 2 implants in the lower will give them something that will click in and out.
So a full set of teeth.
Full set of teeth, snaps in, snaps out. So they can remove it, clean it, put it back in.
What about adhesive in the back? Do you still need adhesive?
You don't need adhesives. I mean, the adhesive industry should really end itself soon.
Do patients not? I mean, is that something that comes up? They don't like it.
Yes, adhesives, most patients after a long period of time, they go through this whole bone resorption. They lose bone because the denture is not unstable. And they have to use adhesives, which is a bad taste, uncomfortable. So enough with adhesives. We can do 2 simple dental implants.
So 2 implants, snap in, snap out?
Get rid of the adhesive, yes. Get rid of the adhesive.
What could they eat with that? In an ideal situation, what could they eat?
So in an ideal
they're
situation, if you look at a full dentition, you have 100% function. When you go through a denture, you have 10%. So you're very limited in what you eat. If you give 2 simple implants in, your function goes back up by about 50%.
So they could eat what?
You can
Lettuce?
eat, absolutely. You can eat lettuce, you can eat less chewy meat.
Okay.
But you can eat meat. You can bite into harder food. You can incise. You can bite into an apple. Not with the same efficiency if you had your natural teeth and the next option. So ideally, we'd like to take that to the next step. So we offer all our patients more implants and only 2 more. So by going from 2 implants to 4 implants, we give them something permanent.
So 4 implants on the lower. We're still talking about the lower.
Yes.
They can get something that doesn't come in, come out.
Permanent, yes.
Yeah.
They don't take it out. They treat it like natural teeth. They put it in. It's always there. They just clean, brush, floss normally. And they can eat absolutely anything. So their function is back up to nearly to how they used to have with their natural teeth.
So what's the oldest patient for dental implants? Because I'm still surprised. It's, 80, 90, you say.
Yes.
I mean, what's the oldest patient you've ever?
The oldest patient that we've had is 92 years old.
Really? So, but at 92, why would they want to do it?
Well, maybe
it seems more painful for a 92-year-old.
It's the pain factor actually isn't that bad. It's not worse for a 92-year-old than a 27-year-old.
Interesting.
But at that point, they want to enjoy it. They've heard about this new option maybe. Like we said, denture wearers are out of the loop. They don't go and see their dentist. Maybe this is the time that they've heard, there is an option, and why not explore it? I'm 92. I'm still healthy. So why not get the teeth and enjoy life more than what I do?
And you're a periodontist, so you have training in IV sedation.
Yes.
Is that right? So most of
these cases, we make them as comfortable as possible, and IV sedation gives us that option.
Is it safe?
It's very safe, yes. They don't go to sleep completely. They're in control, but it's like an amnesic effect. They don't remember what's happened.
Really?
And they wake up with a full set of teeth.
I see things like on your website where they walk in.
Yes.
And I'm very skeptical, by the way, and people need to know this is a real interview. I'm not siding with you, but they walk in with no teeth.
Yes.
I mean, just a denture, and then they walk out with a fixed set of teeth.
Fixed set of teeth. As we say it, as you see it on the websites, patients walk in with no teeth or with bad teeth and walk out with a new smile.
Now, if it doesn't cost more to go to a specialist, do you have a bias that you think that they should see somebody like you?
Well, I think implant dentistry, there's nothing new to implant dentistry. It's been around for probably 40 years. That's a long time. The success in implant dentistry is high, and we want to keep it that way.
Okay.
One of the ways to do that is training.
Go to somebody with a lot of experience.
Absolutely, and I heard a colleague of mine once say that he's against weekend warriors, and that's what he calls, people that go on a weekend course to get trained on this modality and start doing it. Trial and error.
But how does the patient know?
Patient should ask,
Really?
if you're having your eye cataract surgery.
Like, how long have you been doing this?
Absolutely. They should look at the credentials. They should look at the credentials.
Do they ever ask you, by the way?
It's all posted on the wall.
Is that right?
And they do ask.
Because 10 years, you've been doing immediate, as you say, this concept of immediate loading.
For about 10 years, yes.
And
in implant dentistry for close to 20 now. But they still ask me, how many have you done, doc? And my typical answer is, I started yesterday as a joke, but, but yes.
Is that your joke?
Yes,
you say that? That's a good one.
We say it. So we started, you're the second one we're experimenting. But you have to ask. It's like going to, having your cataract surgery done, for example. Don't you ask, how many have you done? What's the experience level is? Same thing.
Now, we should mention, insurance across the U.S.,
yes,
even in Canada, I know, does not cover the whole procedure. Does not cover
it. Doesn't.
And, but you offer financing?
We offer
You
financing.
try to make it affordable?
The cost of treatment now is less than half of what it used to be.
And you could be 80 years old, 90 years old.
You can be 80, you can be in your 20s.
What about a little bit of osteoporosis?
Again, that's a concern for most of these cases, and all depends on the case. Is case by
I mean, if
case.
you're 80 or 90, you pretty much have a little bit of osteoporosis, right?
You do, yes.
So-
But there are ways around it.
What about type 2
tests.
diabetes?
We do tests. There are tests available to check how at risk patients are when we're dealing with osteoporosis, for example. Diabetes, obviously, if they're controlled, we treat them exactly the same as regular patients.
So in 10 years, though, have you had to turn anybody away? You said there's nothing I could do for you?
Of course.
But just a few?
Just
would you
a
say?
few, yes. I mean, we see a
obviously,
lot of cases.
if you're having cancer treatment or whatever, that's a different issue.
Those are different category. I mean, this is an elective procedure. So
But if
when
they're
we're
healthy enough to get out of their car, walk into you,
then they're good to go. For the
Is
most
that
part,
right?
they're good to go, yes.
well, good for you. Okay, and again, so don't be afraid of fear. It doesn't hurt, you say.
It doesn't hurt,
You could get it done the same day.
yes.
And you say no more dentures.
No more dentures.
You're going to wipe out dentures then in Oregon?
That's the aim, and that's where we're headed. You know, especially when the costs come down, then there's no point going through that denture, period. So we can go from, failing teeth immediately to something comparable.
So people that have been told your teeth have to go, because there's a
Yes.
group of those people. So they have to make a decision: dentures, traditional dentures, or
Some form of implant.
like an implant with a denture
Retained,
snapped on top.
Exactly. So I mean, we see as our specialty, we see a lot of failing teeth. Gum disease being the most common reason why we lose teeth, and unfortunately, we get cases that are really too neglected. It's too late, and none of the therapies that we have available really can salvage those teeth. So we have to say, Mrs. Jones, your teeth need to go. But the option is it a denture situation, which nobody likes, or is it the more permanent fixed option using dental implants? It's
And
fused
the upper, you could remove the palate. you said.
Exactly. So one of the concerns with denture, with the upper, is food. Your palate is covered completely with plastic. So when you're eating, you don't have the same sensation. The taste is gone. It takes a long time to adapt. So with the implant concept, we put the implants in, that palate is still open. So when you eat, your speech,
They like this?
your
Is
smile.
that a big difference for them?
There's a
Do
big
they say
difference.
that?
That's a big incentive for people to go and remove that denture, replace it with something that's implant retained.
So, as a periodontist, you're doing
Yes.
a lot of complex procedures,
Yes.
gum recession, this and that. And you say these are happy people. Do you ever get people that want to hug you
All the
after
time.
it's all done?
Absolutely.
All the time?
All the time. The first comment is really, why didn't I do this before?
Really?
And when they smile, it takes a day or two to get adapted to the new smile. Don't forget, these are people that have been missing teeth for a long time, and suddenly there's something permanent in their mouth. So it takes some adapting, but immediate. The change in their persona is almost immediate.
So to come see you for denture,
Yes.
there's really no charge for the consult, but they will just have to pay for like an X-ray or the CT.
Yes. We do a flat fee for the whole treatment.
Okay.
And the imaging that is required in order to decide what sort of treatment best suits that case is done immediately. Patient can see it, see exactly what we're discussing with them. And that is, again, part of the whole treatment. So really there's no cost initially.
But these dentures are skeptical. I think that's
Absolutely.
interesting. They come in and they say, "Doctor, are you sure?" Do they say that? Are you sure I'm not too old?
Absolutely. One of the cases I had a patient, 82-year-old, long-time denture wearer, a partial denture wearer, still had a few teeth left. And she has never been without a denture. At night, she sleeps with it. One of her concerns was, how does she adapt with a full, complete set? Because she needed to lose the other 3 teeth that she had left.
Mm-hmm.
And the husband was an issue. She didn't want her husband to see her with a complete set that has to be taken out at night, and ill-fitting. Speech will change. So she was one of the initial patients that went through this immediate all-on-4 graftless procedure, and within 3 hours she was with a whole set of teeth fixed, didn't have to take them out, and all smiles. So yes, skeptical at
So
first.
do you feel good about it? That's
I
an
feel
obvious
great.
question.
I feel
guess,
passionate about this because I think it's where the future of implant dentistry should go. We really should slowly eliminate the need for archaic type treatment like dentures,
Okay.
because the options are there, and cost is always an issue for patients, but there are ways around it. And if it can make a huge change in their lifestyle.
So
in
the
their-
denture wearers, okay, so there's,
Absolutely.
I mean, within an hour of your practice, there's tens of thousands probably of people wearing an upper lower denture.
Yes.
That with two
It's
implants.
a matter of calling
4,
us, come in, let us decide what is best for you.
And all of them you say, and I'm not trying to side with you, but
Yes.
if they all say I should have done this years ago because they eat so much better, they can
Yes.
chew.
They
And with
can
the
chew.
fixed set of teeth, they can eat anything, right?
Yes.
I mean, they can
eat
chew.
corn on the cob. They can have steak. They can have any food. I mean, the vegetables that they didn't eat.
They can have
really.
raw broccoli if they wanted. Is that right?
Exactly. They can chew on anything. It's permanent. It's fixed.
And people are pretty miserable, I guess, for a long time before they finally do something about it.
It takes a long time, on average about 5 years maybe, before you pick up that courage
nobody
to go
wants to
in.
go to the dentist.
Nobody wants to come and see us because, you hear stories. Pain is one of them, a long period of not having teeth in your mouth is another one. But all that's in the past. So we've changed things. Again, that's the paradigm shift that the paradigm shift that's happened in implant dentistry.
So go to Dr. Haghighat.
Come and see us, and hopefully we can
And they get to meet
change
you?
the way
Do they
you
get to meet
smile.
you?
Absolutely.
All right.
I'm there every day.
All right. And I know you have photos on the website and a lot of information there.
We have plenty of photos, plenty of patient testimonials. They can call patients that have actually been through the procedure and discuss their experience if
Good.
they want to. We do that all the time.
And I know you have a nice video that we looked at, an educational video.
Yes.
From single tooth to kind of really helping tell the story.
To the denture wearers, yes.
And I thought you were going to be a very serious guy, but you have a nice smile and you're very friendly. Because
Thank
even
you.
I'm afraid of the
Thank
dentist,
you, Randy.
even when they come on my show. So I want to thank you so much.
Thank you. Pleasure.
All right.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could visit our website at wellnesshour.com. You could put in dental implants, Oregon, and you'll find him there. Or you could, if you could spell his name, Dr. Haghighat. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.